Hey everyone, it's Alex Nottingham, founder of All Star Dental Academy, and this is like our part 4 of our case acceptance journey. I have Larry Gazzardo, our head instructor, Eric Vickery, all-star coach and case acceptance specialist. So we're going to talk about today is, and it's going to be fun because I didn't prepare these guys at all about that. They've never seen this. This is actually a clip or a portion of the webinar that I'm going to kind of go through with all of you and with them, and we'll have a discussion about it. Let me pull it up. Now, for those who are on podcast, you won't be able to see it, but that's okay. We'll discuss it, and it will be discussed in the blog post. It will be discussed, in the YouTube video that you can see it. Do you all see the conversion black hole?
Mm-hmm.
Okay. What we find is we've been talking a lot about case acceptance. We want to kind of see the funnel. Black hole is a funnel. Where is the money going? We talked about in our journey about the patient experience and the importance of the patient experience and how it starts from the very beginning. So what we found is if you have $1 million practice, you need about 5 million in opportunities, because not everybody in opportunity is going to convert. We all get that? So we start with 5 million. Those are going to be new patient calls, or going to be insurance if you take insurance, recommendations. So what we see, and this we talked about, this is kind of an offshoot of the business growth formula that I discussed about in our dental practice excellence webinar. When typically the call conversion, 35% according to call tracking research becomes a new patient, only 35%. So on the phone call itself, you just lost 3.3 million. You follow? So basically and it's funny, I'm watching on PBS about black holes, the event horizon, where it gets sucked in, right? We have the $5 million of matter potential. And because we weren't effective on the phone, we lost the vast majority of our opportunities. And we're training on case acceptance. We've been talking with Eric, you're a specialist. Larry, you teach us all over the world. And in a moment, we'll get to something that really will set Larry off. We're not there yet, but it's important to do case acceptance. That's why we have a webinar that I'm inviting you to come to, and it's free to learn about case acceptance. But there's the elephant in the room, that understanding that the makeup is case acceptance, which is ultimately at the end of the day, why do we want case acceptance? We want it because we want to be able to make money, to live our life, to serve our community, to serve our employees, and to enjoy what we do and have that balance. I believe we can have it all. But if you want to understand the function or how things work to get to the result of patients, agreeing, you can't get case acceptance if you can't convert a phone call. Am I right?
I would agree.
So
Yes.
It starts, would it be, and again, I didn't prepare you guys, would it be wrong to say case acceptance starts on the phone?
Absolutely.
Yes.
And wouldn't you say that if the vast majority of our losses are converting phone calls, we would want to start there?
Correct.
Absolutely.
So for those listening, if you're not stellar on phone skills, you better. And of course, All-Star, we're world renowned for this, and we have a lot of training, and you can check that out. And we have free training as well to get to know our stuff. But my point is not a plug for All-Star, but just to raise the issue of this black hole.
Right, because on the phone call, that's where people start formulating a vision of who they
Right.
think you are and what you know and what you're going to be like. They've already decided that before they've even met you.
Exactly. And we were talking about rapport before. We were talking about the co-diagnosis. It begins here. So that's there. Now check this out. Now, Larry, this is one of your favorites. Broken appointments, showing up. 85% typically show up. Of those 15 that didn't in this black hole, that's another $250,000 lost in opportunities because you didn't know how to schedule properly. You're not productively scheduling. We have a SSS scheduling system, another system we teach, but they didn't show up. So you lost more money. We're not at case acceptance yet. And you just went from 5 million to 1.5. You're out, what is that? 3.5 million? Gone?
Mm-hmm.
Okay. Then now we get the case acceptance. case acceptance, according to most research studies, is around 60%. That's what we were talking about 60% is reality. So that's another $600,000 lost because of case acceptance. And that's what we're teaching in these podcasts, in these discussions and episodes, in the training materials, in the webinar, and the course. So we went from 5 million, crossed the event horizon of this black hole, boom, 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 and we're getting squeezed down to 900,000. So about 1/5 of our opportunities, or 4/5 are gone. Was that 4/5 is 80% gone. So we start with 100%. We now have 20% of our opportunities. That's not a very good batting average, and even in baseball, right? You're batting 200% or 200 point, whatever you call it. But it's worse than we think. And we talked about this in our first discussion together, is that when you go to reality, the reality is more like 30% case acceptance. Because Eric, you were talking about, we're saying yes to that one tooth, but we didn't take advantage of the whole plan. So now we're at 450 left, right? We're not even at 1 million practice. We're at the 450 practice, because that's the reality of it, what's happening. So we start from 5 million in opportunities. We're going down to an ultimate loss of 4.5 million, okay, through this process. And you're anywhere between 90 to 95% of your opportunities are lost. So you're only really gaining 5 to 10% of opportunities out there. And this is where, again, perspective. We're all saying, I got to spend more money on marketing. I have to hustle more. I have to bug people more. I have to manipulate. You don't. This black hole is demonstrating that if you can shift a few things, you can do it the right way. In Larry's words, seamless experience. In your words, Eric, co-diagnosis, service-based methodology. We're all trained together, not separate silos. We're all cross-trained. We're doing it little by little. We can take bigger chunks at this, that there's a lot there for us to work with. And so the kind of insight is, not just phone skills is our biggest chunk, right? So I know our topic is case acceptance, but I'm sitting here looking at this funnel, the beginning of the funnel, and I'm saying, man, because there's so many dentists I talk to that they may know their show up rate, they may know their case acceptance rate, but when I ask them, how many phone calls are you converting? They don't even know. They have no idea. And so my thesis here is, phone skills and the entire patient experience you better get good at if you want to increase case acceptance. So I'm kind of giving y'all, and I'm still going to post a link for the webinar. This is kind of the secret, one of the secrets you're going to learn on the webinar. I'm giving you kind of a taste of it. There are more. There are 3 that I'm going to cover, but I wanted to give you a taste because I thought this is pretty powerful. I know, Eric, you have your finger up. What do you think, Eric? Did you care to comment on that? And then Larry, too.
No, it's so funny. Of course, I have a tracker for this, but we track new patient phone calls coming in, and I break it up in columns: non-insured, and maybe like a delta insured or something, and how many calls we get from each, because we want to know certain marketing things that are working or not. And then, like just yesterday, working with an office in San Jose, and 21 new patient calls in the month. That's not very many, first of all. And if you're only going to get 21 calls and your goal is to see 15 new patients a month, guess what? You better have a really, really good conversion rate, and you better know how to do that. They had 13 of those patients not scheduled. We were working on that. That was something we were, what was the scenario? What was the objection? What was the reason for it? Now, I'll give them some credit, a lot of, Medi-Cal, Medicare, Medicaid type phone callers, but we talked about how to work through those too. Can we get some of those? And we're not a storefront. We don't have a bunch of foot traffic coming through. We don't.
Yeah, Larry, you talk about that too a lot. Yeah.
We don't have hundreds and hundreds of people coming through like Walmart hoping they just pick up a little thing. Their sale per customer could be very small because they have a big volume.
Right.
Our sale has to be very big because we have a very low volume. That's customer service, that's relationship, that's high quality. And so every single phone call, every time that phone rings, if your perception is, oh, it's interrupting my day, I can't do what I need to do, and that it just starts right there. You've got to pick up the phone, and the way you answer the phone has got to initiate the relationship. That is case acceptance's relationship.
Yeah, and Larry, when we spoke together in Atlanta a few months ago, you were saying that you can't. This goes to broken appointments, right? And the others, you just can't. You can't make it up. You can't just,
No.
like Walmart. You can't just open the hours and work till midnight and on weekends and make up the money. And I think you said, like, with businesses, they can be negative all year, and we'll just a few days will be open and we'll go
Because
and
they
make
make
a
up
profit.
the majority of their sales during the holiday season.
Right.
You
Right.
know, we can't do what they're doing, so we got to be good at it all the time.
And you can't be inefficient.
And along with call conversion and the other things that you're talking about, is that you've got to give reasons for people to want to come to you. And so it does go back to training and
Sure.
kind of understanding, like, well, what are we good at? You know, why do people choose us? You know, are we good at crowns, veneers, implants, whatever it is? So that when somebody says, gosh, I have a toothache and I think I'm going to need a crown, we feel very comfortable saying, well, you called the right place, you know,
Right.
because we've got a lot of training in crowns or whatever it is. And so I know that we're going to be able to help you. You know what I mean? Like, so that training is important. People have to know, why am I calling this place? What are we good at?
There's one thing that occurs to me is, I think the overarching principle, like you say, Larry, is this commitment to service, this commitment to getting to know the patient, standing out, because we have to be able to stand out to compete in general, and to compete with corporate dentistry. Not that they're bad corporate dentistry. We have DSOs that are involved.
No, but those people are very well trained.
They're well trained, and you can no longer be complacent. You can no longer be ineffective, because corporate models are seeing dentistry. They see this black hole. They know the potential. They're like, I can do it better and get more out of the black hole than they can, and I'm going to do it and wipe you out.
Yeah.
And so it's important that one thing where we can compete, okay, that's different, is that we can commit, because if we're smaller practice, because it's a range. You have the private practitioner, you have certain level DSOs, all the way to really
Right.
corporate. And I'm not saying one's good or bad, but the smaller you are, the advantage you have is you can change quickly. You can make decisions quickly, because with corporate, you have to go through a bureaucracy and whatever. And corporate, to the negative, is they, as you see in the government, any bureaucracy, they're slower to change. When you're smaller, you can change. Now, what do you change to? You see the potential, you see the importance of service and the importance of training. Now, what I see some of our offices do, and Eric, you do a lot of our on-site visits for offices, and one of the things that we do, and we encourage them when you come in or Larry comes in, is, and we've been marketing this, they're so proud of their training that when they're down for a day, they put a sign, we are closed for training because we're training with All-Star Dental Academy. Okay, here we are. We're training to serve you. And it's a marketing, and that becomes, your training can be your marketing. You know, we're proud of training. Like Larry said, when you're calling, we train our team.
Well, we're learning how to schedule so that your appointments run smoothly.
Correct.
And get out of here on time.
So I'm saying
it's for you.
So I'm saying there's got to be a commitment. So you have to see the problem, right? Because we all know we're motivated more by pain than by pleasure, right? And we want both. But the situation is, we see that the problem is we're getting clobbered on, we're very ineffective. We're very inefficient, and we're looking all over the place. Because if you don't, and this goes back to what we talked about, gentlemen, we talked about if you're not on the same page with the dentist or the patient, your case acceptance is not going to work. So you have to know your own issue of your business and why it's not working and how to improve it, the numbers and where to focus on. Okay. But what Larry, you're saying beneath all of it is this commitment to train, this commitment to serve, this commitment to communicate.
To communicate,
stick with it.
Because some things that we talk about, it's not anybody's fault. It's just not natural. You know, like, it's not natural to ask a lot of questions.
Sure.
It's easier to say, oh, you're Medi-Cal, we don't take that, we can't help you. When in reality, it's like, tell me what's going on. You know what I mean? Just because you're on Medi-Cal doesn't mean that you can't pay for other things.
Well, it's where the old way is transactional. You call, here it is, yes or no, move on.
Yeah.
My insurance cover is not. We are, for the dentists that are following us, are typically are those that they're not necessarily. So again, if you are a drill and fill, not that it's a bad mass production practice, service is still important, and
Yeah.
training that we train may be helpful because you're better than the other ones that are doing that. But the ones that want to really embrace the service mentality where it's not transactional only, right? It's a different level of sophistication and training and commitment. And it ain't easy.
No,
If
no, no.
you're
Like
really,
one of the simple things that we talk about is just cross training,
yeah,
so that the phone can be answered all the time. And the person who's talking on the phone doesn't have to feel like they have to rush because
that's
somebody's
right.
standing at the desk because nobody else knows how to check out this person.
That's right.
So it's something as simple as that. We again, I kind of alluded to it earlier, but the things that we talk about take training because it's not natural for most people to do the things that we're talking about. It's not the way that we normally communicate. We normally communicate in transactions. Yes, no, goodbye, finish that. And you got to have cross training. Everybody's got to know a little bit about how all of this works so they can help out. We're not like the corporate guys who have call centers, who
Right.
are very specifically trained, and if we're going to be able to compete with them, we got to know how to solve problems for patients.
And like I mentioned before, you can win if you don't have if you can be flexible with and you can commit and you can stand out. Those are the importance, and have that extra feel to it. When you guys saw the black hole, did it surprise you what you saw?
No, no, not at all.
But and I'm glad it didn't. But when you see the numbers, that's a lot of
When
being
you lay it out,
addressed.
it's not surprising. It's wow, that is a lot. I'm not surprised that that it's happening that way, but I am going, man, there's so much opportunity that's being missed.
Yeah, I agree with you on that. The
Yeah,
opportunity is there. It's not for lack of opportunity. Even for the dentists who might be thinking to themselves, but I don't even get that many phone calls every month. There's an opportunity that's lost.
that's
That's why
right.
you're not getting the phone calls.
Right. And I think we're working at two levels, right? We're talking to the dentist who's following us and saying, so if I put a number to it, I say, okay, you're missing X percent, right? Of your, oh, okay. Or it's 100,000. Okay. But when you can see it and you can feel it and you can, really, then it hits. It's got to make that. And the same thing with the patient. The corollary is the patient is for case acceptance. It's got to resonate with them. It can't be intellectual. So I say black hole. Black hole is a powerful force. Oh my gosh, right? With a patient, like you were saying to me, Eric, in a few of the episodes, my grandfather had the issue, right, that you're talking about, and I don't want to have that same issue. And you might say, oh, it's gonna cost, you're gonna lose. It's got to be relevant to me, and it's got to be we as human beings, and this is supported by a lot of the advances in neuroscience and some of the newer psychology like neurolinguistic programming and all these type of researching that is showing how we tend to interact with imagery and with emotion. Our emotions don't respond well to intellect. And we've developed our prefrontal cortex is highly intellectual, but that doesn't change emotion. You all heard, and it's very true, we make decisions on emotion. We justify them with reason.
Logic or reason.
So we have to be able to, with a patient, convey to the emotion that's rapport. And one of the subsidiaries of that is emotional intelligence, how to understand emotion, how to relate, not to show how much I know or how smart I am.
Right, right. Eric was talking about the why kind of thing. It fits into all of this, emotions and all of that, because people just clearly do things for their own reasons. Intellectually, people know how to be healthier. They know how to be wealthier. They know how to be spiritually enlightened.
Right.
They know all this. It's a choice as to whether they're going to do it or not.
Right, because we know it intellectually, but there's something emotionally that hasn't been healed or hasn't been didn't click.
Yeah.
you know, and that's where we have to, that's why the issue of rapport training is such a, it's life training,
It
because you
is,
got to know
because yeah,
yourself and others.
if a logic wasn't enough, all you'd have
Yeah,
to do is say, hey, your tooth is cracked. Why don't we fix it? And
Boom.
they
right,
go, no,
exactly.
I'm not doing
Yeah.
that because I'm not paying for your new boat.
Yeah.
Yeah,
Because now emotion just kicked in.
right.
When we ask people at the seminars, right, we ask them who just recently made a big purchase, who just bought something. And somebody will raise their hand and they'll have bought a car or maybe a new home, or had one lady say she bought a ride-on lawnmower. And so then I'll ask that same person, they say what the item is they bought, and then I'll ask them again, well, what did you buy? And they look at you confused, like, I just told you what I bought. I bought a ride-on lawnmower. No, but what did you buy? They think about it for a moment, and that particular one said, well, I bought more time with my husband.
Yeah, that's right. That's right.
Because now I can mow the lawn in 5 times faster. We have a lot of lawn, and we spend the whole weekend caring for the lawn, and I don't get to see him.
That makes sense.
And so when you go back into dent and you think, oh, it's just dentistry, it's something different. There's more emotion attached to people's teeth than anything else.
It's true.
It's health. And so using the Alex example is when you bought scaling and root planing, what you bought was avoiding tooth loss like your grandfather did. I had a grandfather tell me he doesn't want to be called Grandpa Brown Tooth anymore.
Oh,
So when he bought his smile, what was he buying, right? The system of this is knowing that before you ever present. And that's what Larry's been conveying this whole time, is you got to build that rapport and find that out preclinical before you ever start telling them what they need to do, because you haven't earned the right to do that. You don't know what's important to them.
that's powerful. And I think that that's a great encompassing of what we've been, speaking to is really making that clear connection. And you're as the dentist or the running the practice, your team members, we have to know this goes back to what you said, Eric, our why are we doing it? What is our outcome, right? And being in alignment with that. Because if I say to you all, and as we bring it all together, we're talking about a service-based approach. We're seeing what's costing. We're seeing it's amazing, and when I say these things that are difficult, and so much opportunity there, I look at it as opportunity of growth. But when you bring it all together, you have to come from that place. You can't say, I'm going to train with All-Star, do something with them, and I'm going to do a service-based approach. But if you don't have it in your heart, if you're not in line with it,
people
it
will
ain't going
sniff
to
you out
work.
right away that you're not sincere. You have to be
It's like
sincere.
scripting.
Yeah.
So Larry, let me give you the last word on just kind of bring this all together. Your thoughts on, being great on case acceptance.
Well, I think to be great on case acceptance is you got to understand what the patient wants, and you have to understand how healthy do they want to be. Because all I can say to you is, if you put something in front of them that doesn't help them solve the problem they think they have, they are not going to accept it. And if they do, they'll just call up later and not show up, or bring the checkbook or something like that. So we put a whole process together to help you get to this point and to make it easy to get to this point. It doesn't take a lot of rocket scientists and analysis or anything like that. But
hey, my black hole was near rocket science there.
That was rocket science, but it was a good illustration of how much stuff we're losing. Like, everybody thinks the world doesn't have enough for them, and I agree with you. The world is very, very abundant,
Right.
And so really it's the opportunity that we're missing, and it's because we didn't have cross training, or we didn't train the staff on how to communicate with patients. Not that they don't know how to talk or be friendly, but we're talking about communication that results in appointments and people coming in for their appointments and paying their bill and telling their friends about the practice. We're talking about that kind of communication.
And actually, I'll post 2 links here. One, and many of you should already have seen it, which is Dental Practice Excellence, where it's one of our training webinars where we talk about phone skills and broken appointments. That's tremendous, and that speaks to the black hole issue. The findings we find, and of course, as what we were talking about, the newer case acceptance webinar, we'll have both those links So man, you guys have some great training. We got some of the best in the industry here with Eric Vickery and Larry Guzzardo, and some wonderful, wonderful resources to have. So I mean, and this is where we come from, a passion that we want to provide for anybody to get, training. That we provide a lot of free training, so at least you have no excuses. You can have it. Now, of course, it's nothing, nothing like going to a deeper level with the real reality of training, but at least you have something and you're able to connect to it. So and we're also grateful that we can share this with you. And because I was telling my wife the other day, just how, and it's amazing what we're able to do. Not only do we help you all with case acceptance, but all the thousands and thousands of patients that get to be treated and treated well. But even what Eric was saying, when we quote sell them or offer them one tooth, when they could have had the entire mouth, not just that it's better financially, but you may have missed out. They may have missed out on the opportunity to get their dreams met,
to solve their problem.
To solve their problem. And here's the other thing. I want to leave you all with this. There are two spectrums. There's a spectrum of overselling, which we focus so much on when we're coming from greed. But there's also the side of under offering, where we're so afraid to quote sell. We're so afraid to give them the possibilities that we are doing them a disservice. When this is a great quote from Jay Abraham: if you believe what you believe to help others, you have a moral obligation to provide them. If you can help them, you have to get over your fear of failure and all this, the fear of rejection, and you have to do it with love and compassion of what's best for them. If it's one tooth, it's one tooth. If it's the entire mouth, whatever it is, that's your obligation. Anything less would not be serving you or them. All right, thank you, everybody. And until we meet again, we'll do this again sometime. Thank you all for coming. I'm sure we'll Eric, thank you for making the time. Larry, we always get to see you. I'm going to have Larry back, some more Larry, lots of Larry, of course. People always love to hear from Larry.
It's nice having Eric here. It really is.
Yeah, thank you, Eric. All right, so until next time, go out there and be
an all-star.